Good morning. I'm Renee Nelson. Thank you for joining us today. And we are going to be talking about a subject. We've talked about this before. And as we talk about it today, I will be scratching and itching and making silly faces because we are talking about ticks. And we're talking about Lyme disease and diseases that come along with the ticks. And joining me today is Maine CDC
epidemiologist.
Epidemiologist, there you go. Sarah Robinson. Good morning.
Good morning.
Thank you for joining us today. And we are in May as we're talking about this, and May is Lyme Disease Awareness Month, correct?
Yes, it is.
Okay. So there's a lot to cover here, and I will be scratching the whole time we're talking and making funny faces, so I apologize up front. First of all, let's talk about ticks themselves.
Okay.
Because I grew up in Maine.
Mm-hmm.
I grew up on a horse farm. I grew up out in the country. And it wasn't until probably about 10, 12, 14 years ago that ticks even got on my radar. Yes. And then much more like 10 years ago that they really started impacting life around me.
It's very true. I hear this all the time that people grew up and they never saw a tick. The ticks are moving. They started in the southern part of the state. They've moved up the mid-coast area, and they're starting to move inland. And unfortunately now ticks are in all 16 counties.
Wow.
But that's a change from when people were growing up. Even from 10 years ago, we had maybe less than 500 cases of Lyme disease.
And now it's
it's close to 1,400 cases of Lyme disease in 2014.
Wow.
Yeah.
Now, for someone who is not familiar with ticks, and it was kind of a learning curve for me, there's a tick, and then there's different types of ticks.
Correct.
Within the family.
Yep.
And some are more problematic than others.
Yes. We actually have 15 species of ticks here in Maine.
Okay.
The two most common are the deer tick and the dog tick.
Okay.
And the deer tick in Maine is the only tick that we are concerned about, the major tick that we are concerned about for carrying disease.
Okay, and that's the one, because they come in different sizes.
Mm-hmm.
When they're not engorged, they're teeny, weeny, tiny little critters.
The nymphal size of a deer tick is about the head of a pin, like the sharpened pencil kind of size. They're really, really small.
Oh, my goodness.
Yeah.
Now, the dog tick is the other one that we see a lot of?
That's the really common one.
And they're a little bit bigger?
They are a little bit bigger. We don't usually see the nymphal stage of the dog tick. So if you see a tick in the summer and it's a pretty big tick, it's usually going to be a dog tick.
And those are annoying and gross.
Right. But they don't carry anything here in Maine.
Okay, that's good to know.
Yeah.
Now, when we just casually kind of look at one, especially if they're engorged, so that makes them a little bit bigger. And when I say engorged, that means that they're filled with
their abdomen's filled with blood.
Can we tell which is which?
You can. It's kind of hard to do without a microscope. On a tick, right behind their head is a shield or a scutum. And on the deer tick, it's dark brown. And on the dog tick, it is white. And so there's a little bit of a difference. There's also a really great service, University of Maine Orono's Cooperative Extension Service offers free tick identification. So if you find a tick on you, you can send it up to the University of Maine Cooperative Extension office, and they will identify it for you, and it's free.
Oh, wow.
Yeah, it's a great service that they
service.
offer. Yep.
Okay, back to the little critters again. So back to the ticks, the bad ticks.
Yes.
That, they don't die off in this, like a harsh winter.
No.
That actually, and a lot of snow, that just makes them all snuggly and cozy for the winter.
The snow actually acts as kind of a protective barrier for them. Ticks will bury down into like the leaf litter underneath, and the snow on top of them just kind of tucks them in. If it was a really windy, really cold, but not snowy winter, that's worse for the ticks.
Oh.
They're more susceptible to the wind and the drying.
Oh, that's good.
Than they are to the snow.
Oh.
So.
Well, that's good to know. At least there's
some hope.
There's some hope. Yeah, exactly. But last winter has just proven to be, because we had so much snow that this is probably going to be a really bad year, isn't it?
It could very well be a bad year. It's a later spring than last year, so the ticks won't be out for as long. But there will probably still be plenty of ticks to be found.
So I guess one of the best ways to avoid these tick-related diseases, Lyme being one that we hear so much about, but not the only one,
Correct.
Is to avoid them.
Exactly.
Can we?
We can make some effort to avoid them. We don't want people to not go outside. It's Maine. It's beautiful. We have the forests.
And it's affected my life.
Yeah.
I find myself afraid to go walking because it's like, I don't want to go for a walk in the woods. I'll go walk someplace else that's a little less problematic.
Right. There are some things that you can do if you're going to go outside. First up is wear protective clothing. Always, if you can wear long sleeves, long pants. I know in the summer I don't even do this because it's too hot for me.
Yeah.
But if you can wear light-colored clothing, you're going to be able to see the ticks better.
Oh.
If you wear socks, then the ticks tend to crawl up, and so you're going to protect your feet a little bit. And you can treat your clothing with permethrin, which will make them. It'll be a tick repellent for up to 6 to 8 washes.
Wow.
Which is really great if you wear the same hiking socks all the time or like a bandana that you can have that will help repel the ticks. It's an easy way to help protect yourself when you go outside.
Do you have to have everything treated with this, or is if you have socks and a bandana and maybe a couple of shirts you use on a regular basis?
I mean, the more you have that's treated with permethrin, the more effective it's going to be. But they do, there's companies that make permethrin embedded clothing. Oh, and so if it comes with permethrin in it, it lasts for 80 to 100 washes.
That's a lot of time in the woods.
Exactly. So they always recommend, because ticks like to crawl up, they recommend starting with the socks. That if you have permethrin-treated socks, if your ticks are coming on your shoes, you're going to stop them right there.
Okay. No, but you shouldn't put that on your skin.
Correct. You don't want to put that on your skin.
That goes just on to treat fabric and let it dry.
Yep, it's toxic when it's wet.
Oh.
So you treat your clothes when they are not on you.
Okay, gotcha.
And let your clothes dry, and then it's fine.
Okay. Is there stuff like a bug spray we can actually put on ourselves?
There are. We always recommend using EPA-approved repellents. That just means that they've been tested and they're effective. Most everybody's heard about DEET. That's the most common one.
Oh, that will work for ticks.
DEET does work for ticks, yep. There's also picaridin, IR3535, and oil of lemon eucalyptus. But you always want to follow the label instructions because, permethrin, it's going to last through multiple washings. Mm-hmm. Repellent you put on your skin, you're going to have to keep applying. It's not going to. You can't just put it on in the morning and think it's going to last all day.
Oh, so even within the day, you've got to reapply.
They'll usually tell you on the label how many hours it's effective for, and so you'll need to reapply. It's like sunscreen.
Okay, yeah.
It only lasts for a certain amount of time, and then you have to reapply.
Okay, what else can we do?
Another thing you can do is ticks are really creepy, but they don't jump and they don't fly. So you have to brush up next to ticks. So if you're going to go hiking, if you can stay in the center of the trail where there's not the grass that brushes up against you, you're not going to be in contact with those ticks.
Which is why, for when I'm out walking with Shadow Dog, he's much more apt to get them because he's
wandering everywhere.
And wandering in the tick zones, on the side of the trail, sniffing all the good stuff.
Absolutely. So if you have woods on your own property, if you can keep it so there's a nice trail through them, if you can stay on the middle of the trail and not brush up against the grass and the brushes on the side, you're really going to reduce your chance of coming into contact with a tick.
And they don't fly.
They don't fly.
They don't have any wings, do they?
Nope. And they don't jump. They just crawl. They're hitchhikers. If you walk up next to them, they will hold on to you and go for a ride, but you have to come into contact with them. You have to brush up against them for them to get on you.
Anything else to avoid the little guys?
The last thing we want to do it's too late at this point in time, but do a daily tick check. Ticks tend to wander around a little bit before they settle in and bite, and so if you come out of the woods, brush everything off, make sure that you don't have a tick crawling on you. Do a tick check every day. Ticks have to be attached for at least 24 hours to transmit Lyme disease.
Oh, okay.
So if you check every day, you're going to remove them within 24 hours, and your chances of Lyme disease, your risk of Lyme disease goes really far down.
Oh, that's good to know, too.
Yeah.
Now, when they latch on, we were talking before, and they do a couple of things that make them... It's gross, but it makes them very effective
They're
at
very
their job.
good at what they do. Yep. So when a tick bites you, it secretes anticoagulant and antisthetic.
So you don't feel it, and then it keeps your blood from clotting.
Absolutely. Yes. They're really good at what they do.
Ick.
Unfortunately.
And you were saying that when they're just running around, they're very little, but after they've done this is when they swell up to many, many, many times their actual size, isn't it?
And ticks don't stay on you forever. They're just going to stay on until they're full. But yeah, they can get pretty big. I've seen ticks that are about the size of grapes, small grapes.
Wow!
Yeah, they're gross.
Oh.
Those are adult ticks, usually. The nymphal ticks don't get that big when they're engorged.
Oh. Okay.
But ticks, I get asked this a lot. Do ticks actually like crawl into your skin and will they stay there forever? And the answer to that is no. They're just going to stay on you until they're full.
And then what happens?
Then they fall off.
And do they digest what they've just taken from me? And
yep,
do they die, or do they come back for more? Like a few
ticks
weeks later?
have a 2-year life cycle about. So when they take a blood meal, it's for a specific purpose. So when they're a nymph, it's so they can molt into their adult stage. And when they're an adult, it's usually so they have the blood so they can lay eggs.
Oh, okay.
Yeah.
But they live for 2 years?
Yep.
2 years?
Yep. It's a 2-year life cycle.
Oh my goodness.
So they come out as the larval stage, and those ones are really, really, really tiny. But those ones aren't a concern. They very rarely bite humans. And a tick has to bite something that's infected with Lyme disease for that tick to get Lyme disease. It's usually small rodents, mice, birds, things like that. So the larvae aren't infectious. They haven't bitten anything to get infected.
Okay.
And then the nymphs tend to become infected, or they can become infected on their first blood meal as a larval stage. And then when they hit the nymph stage and then they move and sometimes bite us, that's when we run into problems.
That's how it gets carried along.
Yeah.
So where did it all come from to begin with?
That's a good question. Lyme disease has been around for a long time, but we believe that its reservoir is in small animals, in mice and squirrels and little animals like that. But where it originally came from, I don't know.
And so as it was in these smaller animals, and now with the tick population growing, that's how this has all cycled up to become an issue for us and our dogs and our cats.
Yep. There's so many ticks that there's not enough small animals to feed on, so they start moving to the bigger animals. And that's us, unfortunately.
Oh, my goodness. Now, there are a number of diseases. There's not just Lyme disease that we're facing, even though we hear an awful lot about that. You said 1,400 cases from last year?
Yep.
And that's on top of the cases that are being diagnosed in the previous years and will be diagnosed this year.
Exactly. And the number keeps going up for Lyme disease, but it's also going up for anaplasmosis and babesiosis.
And I mentioned this before. It's Powhatan?
Powassan.
Powassan.
Yep.
And I only mentioned it because I had a family friend who passed away. His mother's passed away from it. And that was nasty and quick. It's not very common.
Right.
But
it's a virus and it causes encephalitis. So it can be very, very serious.
Now, what if we see the tick and we get him off of us? So less that 24-hour window, our odds of getting Lyme are quite low, correct?
Correct.
What if we don't know? Because they are tiny little things. They can come and go without us even knowing.
Basically, it's a watch for symptoms. The earlier you can find symptoms, identify symptoms, and get treated, the better off you are. So if you've been in outdoor areas, symptoms can take up to 30 days to occur. So basically, all summer long, make sure you're checking for that bullseye rash.
Okay.
If you see that rash, that's a hallmark. That's classic Lyme disease. You don't even need lab testing. You have that rash, you have Lyme disease.
But not always.
But not everybody who has Lyme disease will have that rash.
And you said earlier, too, that this can show up, you can get bitten in one area, but it will show up in a completely different area.
Yep, it's most common that the rash will show up around the area where you were bitten, but it doesn't always happen that way. So you could remove a tick off of your leg and have a rash on your back and never see it because you're not checking your back for that.
Oh my goodness.
So we just want people to be aware, looking for that rash.
So that's the one of the big things.
That's
what
the
else?
Easy one.
The easy one, yeah, that one's...
If you see it, it's a done diagnosis. The other symptoms of Lyme disease are harder. It's vague. It's joint pain. It's malaise. You can have a slight fever. Basically, we tell people that during the summer, if you feel like you have the flu is really not common during the summer. That's a sign of a vector-borne disease. It could be a mosquito-borne disease. It could be a tick-borne disease. But if you have more than a couple of days where you just really don't feel good, it should be enough to trigger you to call your doctor.
Okay, because you say like joint pain, fatigue.
Yeah.
It's like
every adult has that.
Every day of my life.
Yes, exactly. But if it's, I mean, of course we all have days where we don't feel good, but if you have multiple days in a row where you just really don't, I mean, like you have the flu, like you're just so exhausted, it's so hard to get things done, you need to consider calling your doctor.
And would that be true for these other?
Yep, the first symptoms for anaplasmosis and babesiosis are the same.
Okay.
Powassan, because it causes encephalitis, tends to have more of the nervous system, so you could get a really bad headache.
Okay.
Any kind of encephalitis can cause that. If you have a headache that doesn't go away, you need to call your doctor.
And again, that's what's so confusing about it, is that it's really easy to brush a lot of that off.
Absolutely.
It's like, I'm having a bad day, I just need to drink another bottle of water.
Absolutely.
Wow.
That's one of the things that makes these tick-borne diseases so hard, is they don't have any classic. Besides this rash, if you don't get the rash, the symptoms are vague. And
testing can be, it is a good thing to be tested, but it also has some
testing
holes
is complicated. Yeah. So the standard recommendation is 2-tier testing. So it's a screening test, which most of the hospitals here in the state do. They do it here at their own labs. And if that screening test is positive, it needs to be sent back out for a Western blot test. But the Western blot test can be slightly complicated because interpretation of it depends on timing. You need to know when the symptoms started. Part of the test is only reliable for the first 30 days of the illness, and then the second part of the test is more reliable after 30 days of illness.
Okay.
So the tests are actually okay. They're not great tests, but you need to know that onset date, and that's really hard for a lot of people because the symptoms are vague.
Yeah, because I have a friend who eventually was diagnosed with Lyme disease, but went through years of issues. And she can kind of tell you where she probably ended up with that tick bite, but I don't think she can tell you when.
Yep. And Lyme disease is pretty easy to treat if it's caught early.
Yeah.
There's standard guidelines for how to treat it. It's when it's not caught early that it becomes much more complicated. And disseminated Lyme disease, it affects your joints. It can affect your nervous system. It can affect your heart. It can cause all kinds of systematic problems.
And it's the time that it would take to create those problems and create that damage.
Yeah.
And when I say time, we're not talking just months. We're talking years.
There are people who probably have had undiagnosed Lyme disease for years, yes.
Oh, my goodness.
Yep.
Oh.
And so the other problem with these other diseases, too, is some people are only tested for Lyme disease, but they might have anaplasmosis or babesiosis, and because all of their symptoms are vague. So we always recommend that you get tested for all of them. They're all carried by the same tick. And so you could actually have one tick that's infected with all 3 diseases.
Would you suggest somebody who's going in to talk to their doctor about this to really educate themselves so they know exactly what they're asking for? Because I would imagine not all doctors see. A doctor is a busy thing, just taking care of day-to-day business. I mean,
at Maine CDC, we try and do a lot to educate providers. We send out a health alert to remind them that Lyme disease is around. We have tools on our website for them, but yes, not all doctors are aware of Lyme disease or have seen Lyme disease or have treated Lyme disease. And so we always recommend, if in doubt, if you don't feel like your primary care physician is knowledgeable enough, go see an infectious disease consultant.
Okay.
Every infectious disease consultant in Maine should be aware of Lyme disease and know what the recommendations are.
Now, where would be a good suggestion to start for getting this sort of information, to even just exploring it more on your own as a person? It's like, let me see.
We have a pretty good website, if I can say that, because we helped build it, but maine.gov/Lyme has all of our public information. It has fact sheets, has tick identification, it has information about the University of Maine tick submission program, it has links to the legislation on Lyme disease, it has, we have curriculum for 3rd through 5th graders to teach kids about Lyme disease and ticks.
Awesome.
So there's a lot of information on our website. Federal CDC also has a great website.
Yep.
And there's
just cdc.org?
It's cdc.gov/Lyme.
Okay.
There is a lot of controversy around Lyme. So when you're going to go look at Lyme disease, always look at who the author is and make sure that you're on a reputable site that has some science behind it, or some it's not just somebody's blog who's talking about Lyme disease.
But I guess the big thing would be just nip it in the bud.
Absolutely.
Just avoid the little
Prevent
guys
it in the first place.
Yeah.
That solves all your problems.
And you'll find those recommendations there, too, to go back and cover the things we talked about, like how to avoid them, how to keep it down.
Absolutely. And also on mainecdc.gov's website, on the left-hand pane, if you're on maine.gov/Lyme, there's a tick or a link for orderable materials. We have little tick identification cards that you can order online, and we'll send them to you. We have tick removal spoons that you can order online, and we'll send to you.
I was just going to ask you about that. We didn't talk about, okay, I find one, I'm freaking out. Once I finally stop hyperventilating, what do I do?
We want you to get that tick off as soon as possible. So we recommend using either a tick spoon or tweezers.
And I have the tick spoon that I got from you guys years ago. I have a little kit. I keep it in my kitchen for myself and the dog. It's fabulous.
Yes, it's easy. Gone. It's quick and easy. It's great on pets because it doesn't pull out their hair as much as tweezers do.
But if you don't happen to have a tick spoon...
Yep, tweezers work great, too.
Okay.
And you just grasp the tick as close to the skin as possible, and you pull gently. You don't have to twist. You don't have to... I was always told you have to go like counterclockwise to unhook their teeth. None of that's true. You just pull gently.
I was surprised. They do hold on.
Yeah.
The very first tick I ever met, I took off a cat. I had no idea what I was doing. And I was surprised the grip it had on this cat.
It takes
a little bit of effort.
Yeah, their noses, their proboscis is actually barbed, and so it helps them hold on when they bite in.
Now, what if it breaks apart when you're taking it off? You don't get it a good clean pull.
It's okay. We always recommend call your doctor. You don't have to necessarily go in and see your doctor, but if you leave part of it in your skin, you're at risk for local skin infection.
Okay.
But it's not going to change your risk of getting Lyme disease. It's more of an irritation sort of issue. So some doctors really want you to come in and they'll help you get it out. Some doctors are okay with you just leaving it and it'll eventually come out on its own. All of it's okay. We just want to avoid the risk of the local irritation. But we also... You hear a lot about people who really go at it with tweezers and they end up with gouges in their arm from trying to get this tick out, and we don't want that either.
Well, and I've also heard and seen online about, covering them with Vaseline.
Yeah, we don't recommend doing any of that.
Yeah, matches, and it's like...
Matches is a bad idea any way you look at it. We don't want to put fire next to your skin.
Yeah.
Vaseline, although it would probably work, is not going to be very effective. It's going to take a long time. Ticks are really good at what they do. They don't have to breathe very often. That's the theme of Vaseline, is that they'll suffocate them. But it's going to take a very long time for that to happen.
So the best thing, just use the tweezers or get a tick spoon.
Get them off,
Just get them off,
And we want to try and get them off without irritating the tick, too. Because if you put Vaseline or if you put a match to a tick, it's going to annoy the tick. And occasionally what they'll do is they'll regurgitate their stomach contents, and that's going to cause a localized infection.
Oh, don't want that.
We don't want that. We just want to get them out quick and easy.
Okay, because I'm thinking I personally don't care if I annoy the tick, but if it's going to come back on me.
Exactly.
Okay.
Yeah.
And you said those identifiers and the tick spoon through the Maine CDC.
Yep, maine.gov/Lyme, and then on the left-hand side, there's links for orderable materials.
That
you can order
fantastic.
It online.
Well, clearly the place to be is to get your tick information, maine.gov/Lyme, Lyme.
Yeah.
Okay. Sarah, thank you very much for coming in today, doing TikTok with me.
Thank you so much for having us.
And, sorry about all the scratching.
It's okay.
Okay, thank you.
You're welcome.